Well, baby, you've been on my mind. I think about you all the time. Oh, I want to see your face. That don't make me wait.
Welcome back to Sleeping Around the Podcast with Dr. Ann and Matthew.
So today we're in Dallas, Texas.
We are.
Everything's bigger in Dallas. That's
Yes,
right
it
here,
is.
right? And so
Yes,
I'm working on my hair. I got my boots, right?
I am so excited for today. I have not only one of my amazing customers, but has become a dear friend. So, ladies and gentlemen, Suzanne Thai is our doctor. Suzanne Thai is our guest.
I'm so excited to be here.
And there's
Yeah.
been a journey since the last time you've been on the podcast.
There really has. A lot's changed since then.
At the last time you were on the podcast, were still doing oral devices, still doing sleep. You were
That's
still
right,
part of
so dentistry
iOS.
as well. You know, right now I'm doing sleep and sleep only. So I'm not doing dentistry anymore.
Congratulations.
And honestly, I couldn't be happier.
Congratulations.
I tell everybody, you know, before when I was doing dentistry and sleep, I had days when I did dentistry, I had days when I did sleep, and I kind of separated that way. And every time I came home, my husband said, "This was a dentistry day, wasn't it?" "Oh, this was a sleep day, wasn't it?" He said, "We're going to have a good night tonight." It's a
I love
sleep
that.
day. Yes, and so things have changed, and things have kind of rapidly been growing. Team's been growing. You know, we have 2 separate teams, one for dental, one for sleep. So I still own my dental practice, but I have an amazing partner that does the dentistry for me. And then I own the sleep practice. But it's been such a whirlwind. It's been so fun.
When you are a person who is living with passion, you don't work a day in your life
There you go.
because of the fact that you now have a purpose and you now are going to influence other people's lives. For the average person who may be experiencing sleep difficulties, having access to a variety of different people who could potentially give you different tools
Yep.
to get you that better night's sleep becomes extraordinarily impactful. And being able to be in the hands of someone who is skilled and passionate means that not only are you going to have access to a treatment, you're going to have access to the right treatment that is personalized for you.
That's right.
God dang, man. That's the feedback we're getting is that and we'll have physicians, we have nurse practitioners that will come up after at Southern Sleep. They were like, I had no idea. So we're still educating people on oral device therapy.
You know, just last week, I saw a thoracic surgeon from UT Southwestern. You know, you would think thoracic surgeon, UT Southwestern, he understands sleep apnea. He knows CPAP is the gold standard. Yet he came and he said, I didn't even know oral appliances existed. I didn't even know. And he was severe sleep apnea. And this is what we discuss with doctors too, because a lot of physicians will think the only option for a severe sleep apnea patient is CPAP. But when I go speak and I talk about it, I said, you know, we're here to collaborate. We're not here to take patients when you refer. We're here to truly help the patient get better. And so it may not just have to be CPAP. We could definitely do dual therapy with CPAP and oral appliance therapy. But, you know, as the research shows, you know, as far as oral appliance goes, mild to moderate cases are highly successful, but also compliance rate is extremely high compared to CPAP.
Right.
CPAP, I love CPAP. Every single one of my team members knows that if a patient comes in, we discuss all treatment options. It's not, I'm a dentist, we're going to do an oral appliance therapy. It is not that way at all, because what is our why? What's the reason? Why are we wanting patients to come? Because we want to help them. We want to help them breathe, want to help them live. And so what does that take? In my opinion, it's just truly understanding the patient. When they come in, I always ask, you know, what brought you here? What started this whole process for you? It's not just, oh, your doctor sent you, let's get you an oral appliance. It's never that. It's what brought you here, what started it. You know, did you get kicked out of the bedroom? And I don't even say that. I let them speak. But in the end, what is it that you're really trying to accomplish?
There you go.
No, I have men that come in and they are just tough as nails. And they're just like, oh, I don't want to be here. Why? And I said, well, tell me, why are you here? My wife's making me. Okay. Well, let's talk about that. So your wife's making you come. Why? I'm snoring. She wants to sleep in another room. All right. So does that affect you? Well, I'd like to sleep in bed with her. Well, sure. But let's talk about more. You know, when I'm looking at your medical history, it looks like you've got an issue with nocturia. You've got an issue with energy. You're saying that you're so tired that you sleep 8 to 10 hours a day. What's going on? We talk. And the more we talk, you'll see a grown man say, you know what, honestly, snoring doesn't really bother me. I don't care about the snoring. But the fact that every time I come home from work, my kids are saying, Daddy, let's play, let's do something. And I'm spent. I don't have the energy. I'm not there for my kids. And it breaks my heart. And the thing is, you'll start to see them cry.
Right.
These men who are so strong and, they're just men.
Yeah.
But then they start crying. And it's the most rewarding thing. Not that they're crying, but it's that we're breaking through.
But what y'all do very well is she highlights the customer. There's pictures, there's videos, there's testimony, and it is powerful. And the more people read that, just like word of mouth, just like anything, they want to go see and be a part of that. And they'll drive from Oklahoma to come see Dr. Thai. They'll come from California to see Dr. Thai because of that care.
Sure.
And that passion. I think you're dead on about that.
And so one of the things that I would just want to kind of rephrase is that very frequently, because there's a business component to what your background is referring to these individuals as customers, right? And so one of the things that I want people to hear.
Well, let me be very clear.
Meaning the people who are getting the devices.
That's the patients.
That they're highlighting customers.
Yep.
And so one of the things, of the things, it's just, it's nuanced, right? But I hear it all the time, regardless of the setting I'm in, whether I'm talking to health insurances or I'm talking to healthcare systems, et cetera. Very frequently, we talk about the customer experience and the customer. At the end of the day, it's not a customer. It's an individual who is experiencing a challenge in their wellness journey. And so one of the things I want to highlight is that for anyone who is watching this, when you are in your own wellness journey, the things that Dr. Thai has just highlighted in regards to what is important to you, that is the driving component that should make a difference in the person you partner with for your healthcare needs. The reason why is because of the fact that the way we're trained is to be able to say, what is the problem? These are the medically validated solutions. Here you go. And this is the way I judge your success. When you start approaching medical practice in that way, you are doing exactly what you just said. You're becoming a bean counter that says, I made the diagnosis, I gave them the gold standard treatment, be on your way. What you now created is a dynamic that if that's not successful, it's the patient's fault or the person's fault. It is not the person's fault. It is the failure of communication in that physician not giving the options that are appropriate. My favorite experience from World Sleep is I had an opportunity to sit down and interview Atul Malhotra. Atul Malhotra is a beast in obstructive sleep apnea. A beast. I mean, you want to talk about publishing, you want to talk about research, you want to talk about amazing personalized care experience and an investment in that. The best thing he stated was that he was giving a lecture and he had said the preferred management for obstructive sleep apnea is CPAP. And he said it, and then someone said, is that your preference?
Nice.
Or is that the patient's?
Yes.
And he said, it humbled me.
Yeah.
I then took a step back and I changed my clinical practice to ensure that the people I take care of hear about all of the options.
Exactly.
Because what might be the preferred based on the available literature may not be preferred for the patient. And when you're talking about how do we need to evolve healthcare, we need to be able to have patient-directed care. I move away from patient-centered care because patient-centered care continues to emphasize that I, as the physician, do unto you. Patient-directed care is that I, as the physician, am your partner. I give you the whole tray of these are the options.
That's right.
I understand, as what Dr. Thai had said, what is important to you, because what is important to you is what we're going to measure as the metric of success.
Right.
Exactly. And do you think every single person, if they choose oral appliance, the very first follow-up, they're like, I love this. This was easy.
Yes.
No problem. And so the thing is, it's understanding the why and what was our main reason, and also reminding the patient what was their why. Because whenever you come in, they're like, oh, well, this oral appliance didn't work. I could only wear it for 3 hours. Do you know what I say? I'm like, you wore it for 3 hours? Amazing. You wore something completely foreign in your mouth for 3 hours. Next night, try 3.5. Next night, try 4. But we're going to get there. And the thing is, we'll be there every step of the way. And so if we do need to realize that maybe oral appliance is not enough, we can talk about dual therapy with CPAP, lower the pressures. We can talk about referring to an ENT. Let's look at the nasal passages, because that has a huge impact on how successful sleep apnea can be. 100%. And so we talk about that, positional therapy, lip taping, all the things, but we're there reminding the patient why do we do this? Because when you remind them of what brought them here in the first place and what they're really trying to accomplish, they are so much better when it comes to success.
Sure.
And that's what I teach my team all the time.
And so maybe perhaps you can give us some examples of people who you've been able to help, and that might be able to, even if it, like Matthew always says, even if we change one person's life,
right.
that's one person's life that we now have improved through the messaging that we're giving.
Who can be their best self when they're so tired? I mean, I'm going to just kind of go on a little tangent here for 1 second, because I've been testing myself many, many times for sleep apnea because I wanted to check, wanted to see. But the only thing I can really relate is, for me, this is going to go a little bit deeper, but
Come on.
I had a really hard time having children. I think you know this. I've had 7 miscarriages, so very, very difficult. When I finally had my child, so excited. We were so blessed. We have 1, and we're so thankful. But I remember he would not sleep. He was wonderful, but he would not sleep at all. And every day, I felt like I was literally dying inside every day. And you all know me. I'm my personality is how I am. Very happy, very excited, joyful, but I was not myself. And so my husband kept saying, "What is wrong with you? We finally have a baby. We finally have everything we wanted, yet you are not yourself. You are just depressed. You don't seem like yourself." And I kid you not, during that time, I thought, I have this wonderful baby, but I can't even function. And this is going to sound dramatic, but I literally felt like, I don't think I want to live. Like it was really, really bad.
Right.
And so I think about these patients that come through, and when they come in, I always ask patients to bring, yes, their spouse or bed partner, because it's really important for them to understand what their spouse is going through, because you might have married someone, right? And they were wonderful, but then now they're going through all these sleep issues, and they're changed, their mood's changed. They've got anxiety, depression, all these things that they didn't necessarily have before.
Right.
And so when we look at these things, so much can change due to not breathing, not getting oxygen in your system. So going back to that man, so he came in, he was really upset. He did not want to be here. I said, "So what brought you here?" Always that question. He said, my urologist is making me come here. And I said, "Okay, let's talk about that." He says, "I get up 15 times a night to go to the restroom."
Wow.
I said, "Wow. Okay, 15 times." He goes, "Well, my urologist is helping me. I've gone down to 6, but 6 is still a lot, because you will not feel refreshed if you are getting fragmented sleep. You're constantly getting up. You're going to be tired." He's like, "I'm tired. I'm getting up so often. That's what I care about. I'm snoring. My wife says, yes, I'm snoring. So she nudges me all the time." But then he came back for his first visit after he chose oral appliance therapy. He could not use CPAP. He said he couldn't have anything on his face. He came back and he's still like, "Oh, another doctor's appointment. I don't want to be here." I said, "Okay." And I'm always coming in pretty happy, because I feel like it's better happy than just why, But then he said, "Okay, here's my SnoreLab app," because I do a lot by checking with SnoreLab, sleep diaries. I really want to look at what's happening, what's their energy level looks like. Are they snoring? Just look at those signs and symptoms. And he said, "Okay." I said, "Let's listen to your SnoreLab app." And you have a high snore score, and you think, "Oh, this is terrible. You've got an oral appliance, it's so high." But then when you actually listen to it, he's like, "Oh, I forgot to, turn it off when my wife and I were just talking, because you hear them talking." And then he said, then you listen and you hear nothing. And you look at the before, because I always have them do a baseline.
Right.
You hear all this loud snoring. And I said, "Look at this." He says, "Wow." He goes, "You know what? I've noticed my wife hasn't been nudging me, and she did say that I'm so much quieter." And I said, "Look at this." He's like, "Oh my goodness." I said, "Okay, remember what you said your main reason for coming here was?" He said, "I do. I want to stop getting up in the middle of the night." I said, "Okay, so tell me, how many times have you gotten up in the middle of the night?" He said, "By golly, I didn't get up at all last night." And he's like, I didn't think this was working, but this is why tracking is so important, because sometimes you don't know unless you track. And then before I said, "Okay, well, we are finished for today." And he said, "Wait, what, we're done?" And I said, "Do you want to stay with us?" He goes, "We all seem kind of fun." I said, "Well, then stay." And but those kind of experiences, and I think you've also seen the one with Ryan, who's near and dear to my heart. He's this 19-year-old child. Mother's been struggling with him for years, and he's a sweetheart, but he's got dysautonomia. So she takes care of him. constantly. She said,
Can you describe what that is for some of our audience?
it's a dysfunction of the nerves for like
your autonomic nervous
Autonomic
system,
nervous
your like
system,
fight and
exactly.
flight system.
Yep.
So many
Exactly.
times their heart rate will go abnormal. Just going from
Sweating,
sitting
blood
to
pressure.
standing. They can have gastroparesis where their stomachs don't kind of empty as quickly. So really,
Misdiagnosis tachycardia sometimes when you look deeper than it is. Yeah.
That's
So
right.
it is. It's anxious. So you're moving. It's many different things. Go ahead.
Yes. And so he was prescribed a CPAP many years ago, and she said he struggled. You know, they knew it was the best treatment option for him. But every night he'd wake up either with it off his face, he'd struggle with it, he would throw up inside of it. And so she would have such a hard time. She's like, I know I need my boy to breathe, but he cannot use the CPAP. So they were from Cook's Children. They were referred to me. And so we looked at everything. And we tried the oral appliance, and he is just the cutest thing. And so he smiles. He's 19, and he said, oh, these just look like braces. And he's just smiling. And then we came back for follow-up. And the amazing thing was she said she used to have to drag him out of bed. She could not get him out of bed. He wasn't sleeping. He could not do the therapy every single day. And then she said, it just amazed me. I said, what happened? She said, I came in earlier than usual. He had his oral appliance in his mouth the entire night. And when I woke him up, it wasn't a fight. He was ready to go. She said, he's not napping anymore. He used to nap like twice a day. He's helping me. She says he's actually getting up and helping me with chores and around the house. And she said, it's been a game changer. And she's just so excited for his future. And so am I.
Yeah.
And so it's been amazing. And one of my favorite things was that she said, you know, I told him, because they drive an hour and a half to come. And she said, I told him, okay, it's time to see Dr. Thai. He said, oh, time to see Dr. Thai. Let's go. And she said, it's so hard for him to go to these doctor's appointments sometimes because he's going to so many. But she said he was excited, but then he was starting to blush and get embarrassed. I said, you know, we love you. We love you, Ryan. So it's been wonderful. So many patients we've helped. And if they haven't just had success right off, then we're consistently working with them.
So I actually am going to go back to the initial personal statements that you provided, right?
Yes.
About the journey with pregnancy and miscarriages. And although may not be relevant to your particular journey, one of the things that is important is that there is a growing body of literature that is demonstrating the significant impacts of sleep on successful pregnancies. And so there's just been several publications out about sleep duration and how that can impact the outcome of a baby, where they can be very low birth weight infants who are being born very premature. We also know that things like obstructive sleep apnea in women who may already be struggling with weight issues pre-existing to pregnancy, if there is undiagnosed, untreated OSA, that it makes it more likely for them to have things like pregnancy-related hypertension, gestational diabetes, preeclampsia, premature delivery, and then therefore obviously implications not only on mom but also on baby. This next piece that I want to acknowledge in your journey is the one that probably many women and men who are watching this or listening to this can definitely identify with if they have children. And that is the significant investment that parents have in the welfare of their children, especially when you're trying to sleep train them and you're trying to sleep overnight. It is brutal. It is a mentally taxing warfare. They make babies cute on purpose because if they weren't, I don't know that people would be able to handle it. But what you're describing is also so relevant because we recognize that many women can experience things like postpartum depression.
That's right.
But there also is many women who look just like postpartum depression, but is truly severe sleep deprivation or another sleep problem that occurs. And so the relationship between pregnancy and sleep and that entire continuum is so important and is an important call to action for any woman who may be either trying to get pregnant, having difficulties getting pregnant, currently pregnant, has the baby, breastfeeding the baby. There's so much there. And so you should not be told it's normal to not sleep well. Right. It's common. Common and normal are not the same thing. Right. And so your call to action is to be your best self for your baby by making sure you're also getting the best sleep that you can. Now, the next thing that I want to unpack is that what you stated about being able to identify where someone is and where they're going. I speak on this all the time. Developing your progress map. right?
Yes.
Understanding what progress looks like and individualizing that. And the only way that you can do that, if you're a listener to this right now, the only way you can do that is to understand your own experience. If you think you can go to a doctor with just your chief complaint and that we have a crystal ball that can really understand your entire symptom burden, that's incorrect. And we're going to fail you every single time. And so that's where that partnership has come from. And so a symptom diary, which can be a part of a sleep diary, of really understanding that full 24 hours of all the things that are burdensome to you or the things that are great for you, help us to better characterize this is your baseline and what does great look like. And let's make a progress map together so that this way we can get to the destination you want.
That's right. I love that. And that's exactly what we do as far as looking out for their symptoms. What is it that they're looking for success? And we go back to it every time. How has that changed since the last visit as we're titrating, as we're looking in, positional therapies, things like that? Things can change. It's so dramatic sometimes with certain adjunct therapies. I had this one lady, she had her oral appliance in and she did the snore score. It was showing in the hundreds. I'm thinking, you have the oral appliance in, but she was a nurse. She was so great at tracking things. And she was saying, I want more energy. I was like, okay, good. And the funny thing was, not funny, but when she elevated, her snore score went down to a 5 with elevation alone.
So like going up on like 2 pillows or having one of those beds that actually
exactly
inclined.
that inclined. And I would look, I was like, but every time she's like, I elevated this day. I did not elevate this day. I elevated this day. And of course, alcohol plays a huge part too on the sedation and the sedative effects on the tissues to relax more, to have more apnea events from, to occur. And so we would mark that. I was like, hey, you see this amount of alcohol that you drank here. This makes sense as to why this is. But the elevation for her was a huge game changer. So, exactly.
You're playing your odds with gravity, right? So when I'm laying flat, gravity is going to be going against me. It's going to make my airway more collapsible. It's going to bring my tongue back further. You incline me, and that's going to be helpful. Similar to when we're looking at a sleep study and we see that there's a positional component. You lay on your back, it's going to make it worse. You lay on your side, it makes it better. And so all of those things make complete sense. So believe it or not, right? We talk about sleep disordered breathing. We talk about sleep disordered breathing a lot, but it is important for people to also remember that the International Classification of Sleep Disorders Edition 3, the newest text revision, recognizes over 70 different sleep disorders, right? And so they're generally categorized into kind of 13 different categories. But sleep disordered breathing does have a lot of attention to it because of the rich amount of investment in terms of research since the 50s, 60s, 70s, really when the field developed in the 70s. And so we do have a lot of attention to that. However, the disparities still exist around appropriately diagnosing people who have OSA. And so it is important to also remember that that is also going to contribute to what kind of treatments might be best. And so when we talk about people between 18 and 50 years of age, we generally are saying that it's more of a male predominant condition. And that's really because epidemiologic studies, meaning population-based studies, demonstrate men are 2 to 7 times more likely than women to have it. It probably, though, is still flawed because of the fact that we generally are screening people, just as you said, of are you a man? Do you have high blood pressure? Are you overweight? Do you have a big neck? And those may be different. And so the reason I tell you this is because you can look at me, you can look at Dr. Thai. Dr. Thai has already said, I've screened myself for OSA multiple times, right? Yes. So I have a watch pad in my car, which is a home sleep device, right? For me to test myself for sleep apnea. Why? Because I'm a terrible bruxer. I grind my teeth like crazy.
Huge.
And that is very highly correlated to people having sleep disordered breathing.
Yes.
Now, in addition to that, I'm a small person. So someone would look at me and go, there's no way she has sleep apnea because she's barely 100 pounds. Like, how can she have sleep apnea? Look how narrow my face is. Yeah. When you have a narrow face like this, you know what your airway looks like? It's a super narrow little airway.
That's right.
And so, and I'm also a person who I'm 40 years old. I'm not menopausal yet, but hormones make a big difference. And so as I'm getting older and I'm more mindful and I'm going, I want to make sure that I'm not missing something, that maybe I don't need a dental guard just for my bruxism. Maybe I actually do need an oral appliance to move my jaw forward. That may give me double bang for my buck. It's going to help me with my breathing, and it's going to reduce the idea of bruxism. So the reason I put that out there is because of the fact that we stigmatize
100%.
sleep disorders all the time, right? And so if I can say openly that, like, I brux, I'm getting a watch pat to see whether or not I have OSA, like, that means that anyone can do that, right? It's because I don't have the insecurities that if I did have OSA and maybe I needed a CPAP or I needed a dental device or I needed something else, that I'm going to prioritize my wellness because I want to be around for my children. I want to accomplish more things, and I want to be my best version of me.
Absolutely. I recently started wearing the Circle Plus ring to sleep with at night and a few hours during the day. And what I've learned about myself, even with an oral device, that I really don't sleep all that great. I would say that I would have bet any amount of money because of what I do, and then I stay healthy, same as you, is that, man, I got to be sleeping great. And so I've been running a test with the help of Dr. Keith Matheny, who will be a guest one day on our show, with this Circle Plus, and it has been eye-opening for me to the point to where I'm actually going to go in and do a PSG. With my oral device.
And a PSG is an in-lab polysomnography. So that is where we, as opposed to what I'm going to use, which is a home sleep device, right? Yeah. And it's just one of many versions of home sleep device. And we'll see if the watch pad even works for me, because I have nail polish on, and I'm unwilling to take it off.
Well,
you have to take that one.
So I literally, have been going around thinking, when you sleep alone for a long time and you have the ego that I have, that, I slept great because I get up early every morning, I have all this energy.
Sure.
But just to truly track. So that's something you said that it really reminded me of this. And I'm also wearing a Fitbit now. Don't ask. But it has to be trackable. Yes, so I am watching this, seeing the markers, guys. When I even barely get to deep sleep, when I hit REM, it's been eye-opening even for me because I'm tracking it. So thank you for saying that. It triggered that kind of the journal. The patients that you have that are willing to go out there and put themselves out there on social media. And I know they probably sign some stuff.
Yes.
If you only knew how much that helps, I can tell you that people read that stuff and they're like, oh my gosh, if Ryan can get help, oh my gosh, you're giving these real life testimonies. And I just love that because, we could go out there and promote as a company or as a business, but to actually have those patients, there are some physicians and some people say, do not take my picture.
Sure. Yeah.
I will not allow it. So I'm curious, are there patients that go, no? Because I know what your close rate is to treating. Yes. Are there patients out there that go, no? Because you have so many on social. That's awesome, by the way.
Of course, sometimes, but definitely there are many more patients that are willing to do it. And you know why? Because I kind of explain why. I said, I'm doing it because not a lot of people would understand or would think that someone like you would have sleep apnea.
Right.
They'll look the way you are, but then if you allow me to discuss your symptoms and what you've been going through, you definitely can help people out there. And that's really what I say. Yeah. And they are just like, absolutely, because especially when they're going through follow-ups and they're doing so much better, they're like, I think people truly want to help others.
I agree.
And so they're okay with it. It's rare sometimes, you get some women are like, I'm not made up and I don't, but next time I'll do it.
I'm like, let me get my hair done, my makeup, does my teeth
exactly.
And so the pictures are awesome. Yeah. And I love that you're doing that. And I agree. I do think it helps.
Yeah. It's what spread awareness. This is what it's all about, is spreading awareness, because we think, in the dental sleep world, we're like, we're making a difference, and we are, but gosh, there's so much more to be done.
So we're making a community of sleep friends. Sleeping Around the podcast is all about growing our sleep friends. Yep. And so that's why if you're watching this or listening to this, you subscribe, but you share, because you want other people to learn the same things that you're learning and to be able to transform their lives, right? Mm-hmm. Now, we're not the only organization that does things like this. And so I want to highlight an organization that does an exceptional job of destigmatizing sleep. And that is one of my very close friends, Julie Flygar, in Project Sleep. Her mission is to make sleep cool. And I have to also highlight some of the great work they've done recently. They were just on Capitol Hill doing some advocacy in order to promote legislation that is prioritizing sleep health and also improving diversity, equity, inclusion types of strategies to be able to reduce some of the discrepancies between care access for people throughout the country, right?
Absolutely.
And so they were there with a variety of other organizations. Wake Up Narcolepsy was also there. People from Hypersomnia Foundation were there. People from SomnoMed were there.
Wake Up Narcolepsy is what.
Yes, there you go, there you go. And so really, what we are talking about is not restricted to just this podcast. What we're doing on this podcast is trying to elevate a broader voice that is creating a demand for everyone to have better nights for better days.
That's right.
I agree.
I love it.
So I believe there's two type of people in this world,
Okay.
Dr. Thai.
Yes.
And so you're going to have to answer. If you're one of those, our friendship may be over.
Oh, no.
So here we go.
A lot at stake here, Matthew.
Okay.
You'll still be my friend.
Are you a sock shoe? Or are you a sock shoe?
When you put your socks and shoes on, do you put
Oh.
both socks on and then shoes, or do you do
I
a
put
sock?
socks on and then shoes.
Okay, good.
We're still going to be friends.
Are we? Okay.
Okay. So are you a cuddle through the night,
Yes.
or a cuddle and roll? Like I cuddle, but now it's time for sleep. And I
Oh,
roll.
completely cuddle and roll. I need my own space.
It's a little hot, right?
We
It's a little bit hot.
recently released a podcast with Dr. Brandon Hedgecock, who's also one of
Yes.
the.
Oh,
I
I
still
see.
can't believe he's a cuddler.
Yeah.
He-
Like it
Brandon's
just
a
shocks me.
cuddler?
Yeah, I
The
don't. I
whole
don't.
night
The
cuddler?
whole night,
Yeah,
his
apparently.
personality, his
And I he'd also say like he would like pull her in, like yeah.
Jenny runs.
So
He's
Jenny-
like, no, you're,
Jenny.
I know.
That's so sweet.
All right, are you a top or a bottom
What do you mean?
when it comes to bunk beds?
When it comes to bunk beds, okay, so I would say top, only because I love heights. Anything the higher, the better. So yeah, I recently went to New Zealand, and my son turned 13.
Yep.
And so I said, "Baby, you want to do something amazing?" He said, "What's that?" I said, This is going to mark that you are become a man." And so
We'll say teenager, but
teenager, teenager. And so we jumped off the tallest building in New Zealand.
Oh my goodness.
Super fun. I was so proud
Hold
of
on.
him.
Bungee, parachute. What would
It's like a bungee thing, but literally you are at the tallest
Oh,
building,
no.
and then they're like, they said,
No.
"All right, 3, 2, 1, go."
Yep. Yeah.
And
No.
then you
I would
go on
need a
your own.
diaper.
No, Dan.
Jump.
Dan, would you do that?
No.
So you are an adventurer.
I'm adventure.
No.
I want to go. My bucket list. I want to hang.
You know what?
glide
I'm
in
not gonna
Rio.
sleep tonight just thinking about that.
Are you the type of person that
Oh.
gets in one of those flying? Your dream of being that flying squirrel outfit?
No, that's not, I would love something like that. I was so sad I didn't get to go to Rio because my dream is actually to hang glide in Rio. I would love to hang glide in Rio. I would jump off of anything. Really, it's
Dr.
just fun.
Thai, I am blown away. Like I'm sweating.
I love heights.
I
and-
don't even like the elevators, these nice hotels, they glass on the outside.
Yeah.
I'll take the inside elevator.
No, my husband, his dream is to be Maverick from Top Gun.
Sure.
And
Mine
so-
too, by the way.
Yes. So for his 40th birthday, I took him to LA. I surprised him. I took him to LA and I got him to fly a MiG. You know, those MiGs. And so he went, and I was so happy that I got it from him because he was so excited. But then I was so sad for myself because I really wanted to go. And he got down and he said, he goes, "I'll pay for it. Can you take my wife up?" And I said, and so we went, and I was going, he said, "Is this okay?" I was like, "Go faster, faster." I said, faster, faster. We were doing tunnel, dives going there. And then he got off, and when we got down, the pilot went to my husband. He said, "Your wife is crazy."
He's like, and that's
So
why I married her.
my buddy did that and ended up throwing up.
It's
Like they
amazing.
teach you how to throw
Oh,
up
they
because
show
the
you how to throw up. Yeah. mhm.
Oh my god.
But I didn't throw up. I said more.
Dr. Thai.
More.
Okay, your
Yeah.
turn.
Okay. Are you a big spoon or a little spoon?
Oh, come
I
on.
am a little spoon. Yeah,
really?
usually because he's usually behind me.
But again, just do that for a minute, then.
Then I'm out. Yeah. Then you go.
All right.
Yes.
In your bedroom.
Okay. These are all bedroom.
Well, sleeping around. Okay.
The top and bottom is.
Oh, get out of it. It's a bunk bed thing. And actually, usually Anna asks that when I stole it. Sorry. In your bedroom.
Yes.
All right. Noise, no noise.
No noise.
So it's
I
got to
like
be.
it pitch dark. No noise. good for sleeping. For me, I mean, well, I say that I'm wrong because of course white noise is very good for sleep.
Well,
but
no, is it-
I like it quiet.
Do you
I
really?
like dark.
Yeah, my brain
It helps
goes
me
too much. I
So
can't.
me
I
too.
can't sleep in
Us
quiet.
too. We
Yeah,
gotta
I have to have music.
Oh, you
I
have to have music?
Yeah.
Oh, do you?
I have like I have a we had it on one of the
bad.
podcasts.
Oh, it's awesome.
It's a mask that has speakers in it.
Oh,
so
yes,
it blocks everything out, and then I can listen to it, and it's great for when I'm traveling too, because it doesn't matter what part of the
It's great for something else too. I know you.
sleeping on the plane.
Uh-huh. Dr. Thai, you have affected so many lives, and seeing your business grow means a lot to me because I know you. And so I'm just proud to be your friend.
Yeah, I'm just proud that you continue to kick ass and take names. I mean, the reality is that
I agree.
you're a she boss.
She is.
And I can't be prouder to be friends with,
Yeah.
but also obviously have you on here to again embolden the voice that
Right.
needs to be out there that's saying sleep is a priority, make it yours, have a better day, and let's just
for the patients.
So Dr. Thai, thank you for sleeping around with Dr. Ann and Matthew. Thank you for
Thank
being
you.
here.
It's such a pleasure, such an honor. I love you guys. Thank you so much.
we're just keeping it between sleep friends.